Hey, how you doing? I'm Dr. Brian McKay at Core Health in Darien. I want to talk to you today about tennis elbow. We all know it hurts. We all want to take a leave, wrap it with ice, a brace, but I think we have a more effective way to help you. So I invite you to listen to this very short video. Hey, I'm Dr. Brian McKay at Core Health in Darien. Welcome. Hopefully you're enjoying tennis and not watching this because you do have tennis elbow. But basically, a couple points I want to give to you is tennis elbow is called lateral epicondylitis. So what happens is the lateral portion of your elbow takes a beating, repetitive strain, from the racket. And now, if you think about it, I mean, the elbow being here, it's just, it takes a lot of force when you're more or less hammering down with the racket. It's a very strenuous motion that's repeated a lot of times when you play a game of tennis. And you don't want to give up tennis. And let me tell you something, a leave is not going to go in there and erase all that. It just doesn't happen. So what we do at our office here is we use a process called cold laser. And the cold laser lets us get into the tissue and start the healing process. But prior to the cold laser, we use a treatment called Groston, which breaks up the scar tissue, because you are going to get scar tissue, it's mostly at the tendon insertions, which are here, that are going to really make the biggest problem for any tennis player. And then you can go ahead and, as you use the elbow more and more, scar tissue begets more scar tissue. So we use a technique called Groston, very, very effective. And we use cold laser to come in here and really stimulate the cells to grow. And when you stimulate the cells to grow, you get a better healing response. I mean, one of the problems you have to think about is when you have, when you get a case of tennis elbow, the force is a lot more than you realize. It's not like you're lifting a 50-pound dumbbell, but you're putting a lot of repetitive strain on not that big of a joint, okay? And when it happens, you're subject to a lot of problems. So you really want to come across with a more concrete way of treating it, let's say, because listen, you take Advil's just going to numb the pain. It's not going to fix the problem. And what you have to do is you have to do an examination. You got to go as far as the shoulder to see if it's coming from a shoulder problem, which it very well can. Is it a wrist problem, or is it just an elbow problem? But it's kind of important to get all those things, wrapped up, because tennis elbow is painful. It's not going to go away. Core Health Darien, Dr. McKay, we get that to go away with cold laser and Groston. So I invite you to stick on to the end, and you can set up an appointment to come in and get it looked at, because if you just want to treat it with Advil, leave, ice, brace it, that's great. You're not going to get any better, I can promise you, unless it's a very minor case. Now, what I do want you to do is, I have exercises for you to do, which you have to, besides doing Groston and cold laser, you have to exercise. So let's make sure we have that as a understanding. It's not going to go away on its own, but with the right exercise and the right treatment, you can be back on the tennis court. All right, listen, thanks very much for listening. Dr. Brian McKay, Core Health in Darien.
Thanks for watching. I hope that you've learned some valuable information. I want to share with you a very special offer from Dr. McKay. It is really simple. All you need to do is click the special offer tab. You will go to our homepage and you will see me pop up with all of the details. I'm certain you're going to like what you hear. So click the special offer tab and look for me on the homepage. You'll be glad you did. Thanks.